These days, teamwork is all the rage in healthcare. Studies document that highly functioning teams save lives and could reduce preventable medical mistakes.
We harm millions of patients a year and probably kill 100,000 or so patients a year, maybe more than that, from medical mistakes.
The problem is, while there's a great deal of talk about teamwork, there's very little rigorous teaching of the skills necessary to produce and sustain highly functioning healthcare teams. And there are even less efforts in hospitals and other healthcare institutions to practice and coach teamwork. A notable exception is the Veterans Health Administration. Over the past 5 years, the VA's primary care clinics have implemented a new model of patient-aligned care teams that teach, practice, and coach teamwork in its hospitals and clinics. In a partnership with the University of California at San Francisco, the Veterans Administration Hospital at Fort Miley is one of the leaders in this effort. Here, the VA has funded a Center of Excellence in Primary Care Education that is immersing trainees, faculty, and staff in models of interprofessional teamwork.
This Center of Excellence is a place where the trainees every day are asked to work in teams, to practice their skills of giving feedback, of working on coordinating care and communicating effectively with other team members. So it's really an immersive or workplace learning kind of experience. And I think that's the real power of the model.
Well, good morning, everybody. We have a new person at our huddle.
A critical part of this new model are huddles.
The quarterback gets in the huddle and calls the play. It's what you're doing in the huddle is actually planning your day. You're planning the patients that you're going to see today, and you're going to look at patients in the future that you're going to see in the next week or two.
Team members come together to review the schedule for the day, consider the needs of patients, troubleshoot problems, suggest quality improvements, plan for upcoming visits, and discuss staff-patient communication.
So we're just working on coverage right now for who is out and who is covering who.
Yeah, we know Sandra is running late. Out of 13 slots, 8 were taken and 7 were used from us and 1 from the ER.
At first, team members did not understand the purpose of the huddles or their roles in them.
It's hard to say you have to huddle. We're not used to a huddle. Physicians don't do those kind of things.
Historically, a provider, a physician would sit, or a nurse practitioner for that matter, but a physician would sit in their office and wait for the sick patient to come in with their, for example, diabetic foot ulcer.
And when I started in nursing, there was, the physician. I was never one of those that stood up when the physician came in and gave them my chair, although that happened back in the day. There was definitely the physician is the captain of the ship, the nurse gets things done. There is no contact really with physicians or pharmacists or mental health providers or any of that.
In the huddles at the VA's primary care clinic, members of different occupations and professions learn, plan, and work together for the benefit of the patient. It is the key place where interprofessional trainees and staff communicate and collaborate.
It's what the RN can bring to the table for this team. It's what the LVN can bring to the table. The clerical staff, they'll come up and they'll say, oh, by the way, this patient didn't show up last time. Do you want me to call the patient?
The RN might say, I've noticed Mr. Jones, he needs a zoster vaccine, and the primary care provider, be it the resident or the internal or the nurse practitioner student might say, but actually, I also want you, the LVN, to remind them to bring in their record. So it's a planning meeting. It's a reminder that patients who've been discharged from the hospital, we need to get them in. It's an opportunity for us all to get together and be on the same page regarding our complicated patients.
The biggest thing for me is it's the relationships. I have the opportunity to work as really part of a team. It really breaks down the old hierarchical model. We get to meet regularly with multiple members of our team. By doing this, we get to learn each other's strengths, and we get to play off each other's strengths to best serve the patient.
The physicians are learning to speak nursing because they're looking at things more holistically. They're looking at things that are more biopsychosocial. They're learning the communication techniques.
The fact that you have a unit clerk, a licensed vocational nurse, the RN, involved in these teams is really revolutionary. These are people who have been voiceless in the healthcare system, but they have very important information to convey about patient care. And the fact that people are taught to listen to these people, the fact that doctors who are learning how to practice are learning how to listen to someone who has been conceptualized as the lowest person on the totem pole is absolutely, it's revolutionary.
I think we have really integrated this flattened hierarchy into the culture of the clinic, where every single discipline, be it a dietitian or a pharmacist or a licensed vocational nurse or a clerical associate, actually has a voice in the care of the patient.
When the huddles first started here, I thought, it's not going to work. No one has time for this, and I'm sure not going to do it. And here I am. I do it every day. Oh my God. When I first started here, I wouldn't even talk. And then, I don't know what happened. I just started talking one day, and I guess I haven't stopped yet. We moved 4 out of same day, but we also have 3 that went to their primaries. 3. I can talk to my team. I can talk to any one of the nurses. It's just wonderful. They're all open to your suggestions, and they seem to care about it. It really works. I'm much happier here now. So is everybody.
By belonging to a team, who all work together to serve and give a good service to our veterans, it helps me follow up on that patient, so I know the patient more, and they get to know me, so the trust that we build up is there. We get to know our team on a personal level as well. We feel like I belong to them and they belong to us.
How often do we get
The Center of Excellence initially implemented a master huddle schedule and a huddle checklist. The checklist provides structure, reminds team members about the clinically meaningful components of the huddle, the patients of the day and their goals, and complex patients who would benefit from visits with pharmacists, psychologists, or nutritionists.
And I guess one thing that occurred to me with this checklist is that it's hard for the LVN to actually know if the form that they're looking at is the newest one or not.
Because like after visit summary form, there's different versions. It would be nice to have the correct version.
While the huddle checklist did provide needed structure, it did not assure the huddles actually happened, or that all parts of the huddle actually occurred. The Center of Excellence devised a plan to have the clinic preceptors of the day become huddle coaches. This has made all the difference. Each interprofessional faculty member, nurse practitioner, and physician is assigned to a team that huddles.
So, does anyone have any concerns or anything that they want to bring up before we get started?
You know, this actually is the first week where I have 30-minute slots. My follow-ups have been 60.
Coaches prioritize the need for a check-in, so team members get to know each other both personally and professionally.
And I'm Maya. I'm the huddle coach. I'm a physician, primary care provider here in the clinic.
So we usually check in the beginning of our meetings.
The huddle coach makes sure all team members' voices are heard, including the clerk, nurse practitioner student, or pharmacist, and that the team communication skills are reinforced.
I just wanted to remind you guys that next Thursday, it's like the first Thursday of the month, and so we should try to make time during our huddle to talk about our dashboard.
Team members now find value in the huddles, especially in how huddles assist in care coordination and planning.
Your 8:30 guy, Mr. Rodriguez, who has been seen by Rebecca, will be here today.
Mr. Rodriguez, he's in his 60s. He's morbidly obese, has a history of hypertension too. Otherwise doing okay, but from what I remember, I think
once teams are well established, the huddle coach moves on to more advanced coaching roles, the most important being communication coach and process observer.
We observe how the trainees are interacting with one another and with staff in their huddles or in sessions like the diabetes board or collaborative case conferences or didactic sessions.
We want to start with the veteran's perspective of his illness. He reports just being frustrated at this point. He states that his AM sugars have fluctuated greatly. He's unable to really see any kind of triggers.
He's relatively young, 54, and he doesn't have a lot of other comorbidities.
We can provide at least some baseline education on kind of lower calorie options and even trying to see if there's any kind of things that within his close enough, like things like a food bank that he might be able to pick up some things, maybe that tying in with social work.
He's been overweight for over 2 years, so he might want to look into applying for federal disability and seeing if that can supplement his income so he can have money for consistent food.
The most important issue for patients, I think, is the communication between the members of all the care team. And so this Center of Excellence in Primary Care Education really focuses on that, on building teams. If you expect people to work in teams, you really do need to train them to work in teams.
Great. So the one I want to bring attention to is Mr. Massey. He's actually, I'm scheduling a phone appointment for him at 10 o'clock today because I think there's some confusion.
It's incredibly powerful to watch people navigate the patient encounters and to have the nurse practitioner student actually give feedback to the resident about the care. And I noticed this about your patient, and actually the resident finding value in what the nurse practitioner found in the patient, and really appreciating that the RN had arranged for this follow-up appointment, and appreciating that the clerk had made a change in their schedule so they could accommodate another patient for an hour visit. Noticing that the pharmacy resident says, don't worry about those new patient you're getting tomorrow because I'm going to call and I'm going to ask them about all their medications and I'm going to figure out what they're really taking. It sounds like, or maybe it's everybody having their role and contributing and feeling like they have a meaningful role, and then really taking better care of the patients.
If you ask me what my life was 5 years ago, I'm thinking, I think I had to do all of it and make sure I took care of the patient and didn't miss anything. But here, it's good. I mean, there's something that the nurse can help me with, something the LVN can do, something the clerk can do. It's a place where everybody works together.
I think the PAC team for me has been incredibly supportive because we have an attending physician or nurse practitioner in the room with us to help us consult on difficult cases, while we also get the expertise of the RNs who know these patients really well. I did have an add-on at 9:30 who's from geriatric clinic. He has some abdominal pain. He's had this complaint before and was recommended for a workup at his last visit. With that, everyone is already booked. Everyone else is sort of encouraged to speak up and give their ideas. Whether the idea comes from the very experienced attending physician or a newer team member like a trainee or the MSA, all of those ideas are considered to be valuable and worthwhile because we each see a really different part of the patient's care in our clinic. If getting through on the phone is difficult, can you send him? Having a team working together, we can each use our strengths that we bring from our background to create a really strong plan with an interdisciplinary perspective. I am very lucky to say that I will be staying with the PAC team model. We found it so effective that we're bringing it to our chronic pain team.
In the VA's PACT model, the patient's voice is central.
I had originally decided not to come to the VA because I'd heard really bad stories about it. Hi.
Hey, how are you? Good to see you.
Good to see you.
How are you doing?
I'm doing okay, some of the usual things.
Good. Well,
A friend of mine, a woman who was a Second World War veteran, invited me to take her, asked me if I would take her over to get familiar with it, and sign up. Just this arm has been, for some reason, been hurting a lot.
wow. Yeah, you got.
And the pain starts over in here.
Oh, good.
You come in and everybody on that team knows your history, so they know who you are, they could call you by name, and it makes it feel more like, I guess, like home. And I know that the people on my team know what's going on, and it feels good. The team approach that the Center for Excellence is training in really contribute to my healing process and make me feel like I'm a part of that team. It's not just that they're here for me, I'm there for them, and we all work together.
This is the wave of the future, and it's just incredible to be on the, to watch it happen, to watch it unfold.
My hope is that the model will expand. I think that all the VAs could be a good place to start.
What's so valuable about what they're doing about the VA is that they're not only walking the walk, they're talking the talk. They are teaching teamwork concepts, and they're putting them into practice, then they're revisiting them, they're refining them over and over again. You see this iterative process. And I've been watching healthcare for over 30 years, and I really have never seen anything like it. What you see at the VA is really quite amazing, because you have pharmacists and social workers and students and licensed practical nurses and clerks and transport workers being involved in learning about how to function on a team, how to deal with patients. And they're putting patients at the center of the team because there's a team around the patient.
I have never been to a civilian hospital or any hospital that gives the kind of care that we get here at San Francisco VA. It is incredible, and like all the caring that I seem to need, that I think people need, is here and quite evident. And you know, you guys have saved my life.